Welcome back to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example, it's a 5-year-old female Shih Tzu who fell from a second-story window. Now, I'm not going to address positioning too much here because we all know that an injured limb can be difficult to position. You all know that when I do my ABCDs, I'm looking for all aspects of the images to ensure that nothing is overlooked. So let's start and zone in on the tarsus and remind ourselves a little bit about tarsal anatomy. As we do that, we can work through A for alignment and B for bone. Of course, the tarsus is the junction between the tibia, fibula, and the foot. The first row of tarsal bones, second row of tarsal bones, and third row are well seen on the lateral view. In the first row, we would have the calcaneus and the talus, which are superimposed here. We know that the talus has trochlear ridges that we can see, and the calcaneus has the tuberosity. The second row of tarsal bones is essentially the central tarsal bone. We'll see when we go to the other view that the fourth tarsal bone also contributes a little bit to this row. The distal row of tarsal bones is all superimposed and is difficult to look at individually on the lateral view, but that would be tarsal bones 1 through 4. From there, we have the metatarsals. The metatarsals then connect to the digits, which would be proximal, middle, and distal phalange. We won't look at those any further today. For the metatarsals, let's continue with our concept of alignment. When we think about alignment, we think about the long bones, as you've seen with fractures, and I also like to think about alignment of joints. The joints that are represented in a tarsal study are the tarsocrural joint, which is the name of a lot of people refer to the tibial tarsal joint, the proximal intertarsal joint, distal intertarsal joint, and tarsometatarsal joint. Although I do expect to see, alignment-wise, a little bit of this lip here at the proximal intertarsal joint, this malalignment of the metatarsal bone relative to the distal row of tarsal bones is beyond what I expect from a positioning impact, and I'm concerned that there's an injury here. I haven't shown you the other view yet intentionally. Let's go to it now. Here you can see there's definitely a substantial injury at that level. To remind ourselves of the tarsal bones, we would have the talus, the calcaneus. Here we have our central tarsal bone. The fourth tarsal bone is, I like to call, a double-decker. So the fourth tarsal bone kind of is part of both the middle and the distal row of tarsal bones. And then you can see the third, second, and first tarsal bones are ones that are substantially displaced here. So superimposition makes this quite a complex case, as well as the fact that the cuboidal bones are so small. But what I think you can see, if you look at alignment of the joints, you can see that this nice radiographic joint space is well aligned, whereas this one is substantially luxated. So we have luxation of the tarsometatarsal joint. I'm going to zoom in a little bit further to allow us to look for fractures. It's really common when these smaller joints are luxated. Well, probably we could even say when any joint is luxated, it's really common for there to be small fractures. So I have the sense there's at least one little fragment here. We can see the distal margins here are quite irregular, and potentially even another fragment here at the proximal fifth metatarsal bone. A small osteochondral fragment, when we see that associated with a fracture, we often refer to this as a corner fracture or like a little chip fragment. Osteochondral fragments are usually edges of cuboidal bones, and they might contain a little bit of cartilage along with the mineralized bone that we can actually see. One thing that I like to be really careful about when I'm looking at joint injuries and looking for joint fractures or fractures of the joints is to look for a slab fracture. A slab fracture is different from a chip or a corner fracture. A slab fracture would go from one articular surface to the other. So using this central tarsal bone here as an example, if there were a slab fracture, it would be a lucent feature that would extend from the proximal intertarsal joint to the distal intertarsal joint. For me, this is mainly a luxation centered here, and the fracture fragments that I see seem to be predominantly little corner or osteochondral chip fractures. I don't see any evidence of a slab fracture. We start at the beginning by saying that it can be difficult to position these patients. One thing that I often recommend in these cases is to perform another view with the patient under anesthesia, and you can even do sometimes a gentle stress or distraction or slightly different positioning to make sure that we've documented all the injuries that are there in order to make sure that we plan the treatment appropriately. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.